Since 2007, we've lost $1.7 million from the state, which is about a 30% reduction in revenue. At that same time, we've had a 22% increase in the number of customers using the library and an 18% increase in circulation. So as our resources are getting less, people are using us more. We used to receive around 70% of our funds from the state and 30% from our small local levy that we have. Now our state funding is down to 52%. So we've lost almost 20% of all of our state funds. And our current levy, we've actually lost about $300,000 because of the drop in home values in Franklin County. Westerville currently is actually the least funded, locally funded library in Franklin County. At 0.8 mils, we're 7 out of 7 libraries were the lowest. We're able to do a little bit more than some of the other libraries because of our utilization of things like self-checkout machines and things that help us use technology to cut down on staffing costs and some other kind of costs. Currently, Westerville is funded at 1996 levels from the state. Since 2007, we've lost $1.6 million in state revenue, and we're geared to lose another $300,000 in 2012 and another $300,000 in 2013. So at 2013, we'll be at 1991 levels, which again is why we've had to make some significant cuts in hours and programs and services. We have 20 open positions, which is about 20% of our staff. Positions have not been filled. We had to close on Sunday hours. We reduced our book budget by over 40%. So those are the kind of things that we've had to do, and we need to bring those back so we can meet the needs of the public. Well, what makes issue 19 so important is not only will we not be able to do the things we need to do in terms of opening on Sundays, increasing our book budget, we would lose an additional 42% of our funding because our current local levy expires at the end of next year. That represents almost 43% of our funds. So we would lose another 40% of our funding, which obviously would mandate some significant cuts in staff, significant cuts in hours and programs and services, elimination of our outreach programs to nursing homes, to schools, and other kind of areas. Well, the very first thing we would do is certainly open on Sundays. The second thing we would do is to put our materials budget back to where it was, so increase that by about 40%. Because we have less and less materials, people are waiting longer and longer to get those materials. And then we have to look at things like some additional parking needs, replacing a 1955 HVAC system, a 1980 HVAC system, and some really maintenance needs that we've had to put on hold because of lack of funding.